This morning, we have joining with us Suzanne Williams, who is owner of Back to Home Healthcare Services in Attleboro. Suzanne is a nursing home administrator and respiratory therapist with over 20 years in long term and acute care. We are very excited to have her here with us today and sharing her experience and motivations working in home care as a person of color. Thank you so much, Suzanne, for being here with us today.
Thank you, Michelle. Thank you for having us and great intro. I love that. I couldn't have said it better. Thank you.
No problem. So, our first question that we're going to get into is what drew you to home care?
So, what drew me to home care? So, I would have to honestly say it goes back to my mother. My mother was a charge healthcare professional, and she was working at a nursing home. And I remember she used to bring us to the nursing home. And I also used to remember as a child and say, wow, why can't these people go home? What's stopping them from being home? And I remember having several conversations with my mom about, why some of the residents and our clients couldn't go home. And I said, you know what? I'm going to take these people home. I'm going to make sure everyone goes home. Everyone stays home. They're going to be with their family. Soon after that, I became a respiratory therapist, and the name Back to Home Healthcare kind of resonated because as I was working as a respiratory therapist, I remember all my clients saying, I just want to go back home. I want to go back home. So fast forwarding that, I became a nursing home administrator. And again, seeing how clients were, some of them were left to, in a nursing home without family members and so forth. And it just started resonating, especially during COVID, seeing people, isolated and not being home. And I said, I bet they would probably thrive a lot better being at home. So back to home healthcare was born, and here we are.
Absolutely. I think it's very important. Home is where the heart is.
Absolutely. I think they thrive so much better, especially with family members and friends and, just having something to relate to.
Absolutely. So, our second question is there a patient story that has stayed with you?
I probably have several over the span of 20 years, but one specifically just recently was a client that I have. She's going through cancer right now, and she asked me to go and take her to get a wig. She had seen a local store when I was taking her to her chemotherapy, and she said, let's go in that store. And I thought to myself, well, I want something more for her. So I ended up calling a couple of salons that actually partner with cancer clients, reached out, made an appointment, brought her to the appointment, and she got a wig specially for her, something that was very similar to what she had, her natural hair. And on top of that, I did a little bit more research and found out that if she got a prescription, she could get it reimbursed. She would be reimbursed for the wig. So now when I go pick her up, every time when she's walking towards me, she just reminds me of the same person prior to losing her hair. So that resonates with us because we know as women, our hair is so important. It defines us.
Absolutely. I understand completely. I actually make wigs.
Do
Um, I do. I'm still learning, but I've made about 5, but I agree completely. I think even a good wig can make you feel like so much better, a whole different person. So I
it.
think that's such a beautiful story.
It is. And like I said, every time I see her, I'm just so excited that I just didn't go, and just do something that was just the norm. I went above and beyond. And I think she really, really, not think, she really does appreciate it. She tells everyone about it, this experience. So
Which I think is very good because it also just shows the human touch as well of going above and beyond for your patients. And I think that means so much to them as well.
it
Thank you
does.
for sharing that with us.
Mhm.
Our next question is what differentiates your agency in the marketplace?
What differentiates them? I say, I believe honestly that me being a clinical practitioner and an administrator has given me a cutting edge. I'm able to wear both hats. Being a businesswoman, sometimes we forget that we're dealing with clients, we're dealing with people, we're dealing with lives. And having that happy balance that I am a respiratory therapist, I feel like that gives me the cutting edge, alongside with the fact that I know exactly what kind of care I want to deliver to my clients. I want them to have healthcare experience, not just the same normal. So I would have to honestly say the balance of being a clinician and a actual businesswoman.
And I think that's also very inspirational too, where even people like myself or other people who are looking at healthcare and home care can look at you and you wearing the many hats as a respiratory therapist, opening your own home care agency. It is very inspirational.
Thank you.
Thank you. So our last question is, how do your interactions with clients and patients reflect your mission?
Again, I would have to honestly say that I lead by example. Um, I would never allow my caregivers to do something that I wouldn't do. So I fill in on shifts. I work with them. But the most important thing for me is to lead by example, and that to me means having my caregivers believe in the mission statement, because without that, they'll feel lost. So I really feel like making sure that you invest in your caregivers, and not so much as your clients, but making sure that they're aware that everyone is treated the same. And I also want to give my caregivers an experience of working for a company that respects them and wants to see them succeed as well. So
Thank you. I agree that is very important too,
yeah.
because with the caregivers as well, just knowing that they have something that they're working toward and working for a company that the clients they makes the clients feel special, but also your workers too, which is very important because it definitely would reflect in the service and the care. And I absolutely think what you're doing is very good. And I'm so happy that I got the chance to speak with you today.
I love what I'm doing. It just oozes out of me. I've been a nurturer for a very long time. And now to be able to take care of people in their home and assist them with their goal and dreams of staying home independently until they no longer can. And I want to thank Home Care Alliance. I just recently got accredited with you guys, and I'm excited to be a part of this organization. And I'm happy that you guys are setting the standards for home care agencies in Massachusetts.
Thank you so much, Suzanne. And congratulations on your accreditation. We're very excited for you.
Thank you.
But thank you so much for just, taking the time out of your day and sitting here for this interview. We're very thankful for everything that you do for your clients, but also for the community and just also showing representation because these stories are very important.
Thank
And it's just great for you to also just have that voice to share it with us. So thank you so much for being here today.
Thank you, Michelle. Thank
Thank
you.
All right.